Hi, my name is Malak. I've been fortunate enough to work for Nauv straight out of graduation almost 2 years now. I've been personally grateful to be able to be mentored by Nauv, but also working with him to expand on his already existing mentorship program for his associates. Nauv is an extremely successful businessman and clinician, purchasing his first practice 1 year after graduation, and since then buying and starting up multiple practices since. One thing I've learned about Nauv is that he's extremely generous with his time, his lessons that he's learned, all his tips and tricks, and he loves teaching and mentoring other associates and students. So for the next 40 minutes, we'll be picking his brain and trying to learn as much as we can to become successful. Firstly, I'd just like to thank Rachel and the ADSA team for setting this up. We really appreciate it, and we hope you all enjoy it.
Thanks for doing this, Malak, and agreeing to have a discussion format. I think I got a lot better with that than just giving a lecture. So yeah, and again, thanks for ADSA for having me on.
Perfect. Let's talk about your life pre-2002, before dental school. What was your childhood like? When did you get the work ethic that you have now?
Yeah, I think, look, watching my parents as we were growing up, money was always a concern, I think, and watching them work really hard. You know, they'd get us up at 4 in the morning and pack us into a car, and they'd go and clean offices, and then they'd come home, they'd go off to their jobs or get us ready for school and the rest of that sort of stuff. And weekends were also cleaning. That was their kind of second job. I think the work ethic was from mum and dad just by watching them, but I think the value of education is what they really instilled in my brother and I, and I think that's played a big role in what's happened since.
And did you know you always wanted to do dentistry?
Actually, no. You know, I'm one of those. I guess I did dentistry at a time when you couldn't just get into medicine straight out of university. So now they've got a system where you can just be guaranteed a spot based on your Year 12 results and based on UMAT or UCAT or whatever it is these days. But back then, you actually had to do 3 years of science, and then you'd sit the GAMSAT, and then you'd get in. And I didn't really want a 3-year science degree, but, not get into medicine, because there wasn't a lot to fall back on. And so I decided that dentistry would be my pre-med degree. And once I finished dentistry, I actually got into medicine at the University of Queensland, and also down south as an undergraduate. But both of those times I kind of rejected it. Dentistry was, I worked a year and then sat the GAMSAT in that year and then got in the year after. And, we earned well. Mum and dad's lives changed immediately overnight as soon as I started working. So for me, I decided I'd stick with dentistry, and an opportunity came up to actually buy one of the practices I was working at in my first year. And it was a pretty tough choice between either dentistry or doing medicine. Medicine was something that I wanted pretty much my whole childhood and growing up. So it was a tough decision. Mum and dad, when I got in down in Melbourne as an undergrad and knocked back that spot, Mum and dad were really disappointed, and we almost didn't speak, I think almost for a week. But the second time around, after a year of working as a dentist and the opportunity to own my own practice alongside medicine, when it was the two of those, I think they were a lot more understanding of the decision. And so, just ended up buying this practice, when this is its second move, I think, second move. That original practice was just a small 1-chair practice, and here we are.
8 chairs.
Yeah, it's a little bit bigger now.
When you were in dental school, so you were thinking of medicine, because you sat the GAMSAT. Did you ever think that I'd one day open a dental practice? Like I'd want to be an owner one day? Yeah,
it's an interesting question. I think the first time that I thought about practice ownership was literally the day that the owner of the practice. So I had 2 jobs straight out of uni. I was working close to home in a practice part-time, and then I was working at this practice part-time. And so we kind of had, I think I was working about 50 to 60 hours a week. It was really full on that first year. And towards the end of that first year of working, when I'd already done GAMSAT and the results for medicine started coming in, I think it was like January or December, January. What happened was the lady that owned the practice, she was a prosthetist, so she She wasn't actually a dentist. She'd started the dental practice to get her prosthetic practice busier, to feed patients into her. And now that her prosthetic surgery practice was taking off, she wanted to get rid of the dental practice. It was just too much for her to run. And she kind of came to me and said, oh, look, no, you're probably going to have to look for a new job next year, because whoever buys this practice is going to want to work in it themselves. It was just a one-chair practice back then. And so I asked her for the numbers, and we sat down with my accountant. We crunched the numbers, and it just made a lot of sense to buy the practice. There was a lot of opportunity there. But yeah, in answer to your question, I didn't know I was going to be a practice owner till maybe a day or two after she told me that I might be looking for a new job. Had no, we're not from a family of business owners. My parents have always worked for someone else, and that's all I've really ever known. So up until that time, just no idea.
Oh, that's so interesting. What was the market like then? Like in terms of practice ownership, because if you never thought of it and sort of you've been working here part-time, what was it like for you then? Did you think about competition? Did you think about, what was your thought process besides the numbers?
Yeah, look, that's a good question. I think back then the market was certainly a lot different to what it is now, in the sense that we had a lot less competition. The University of Queensland graduated 43 students, I think, the year that I graduated. Now, and there was no Griffith and there was no JCU. Now in Queensland, there's over 300 graduates, as you know. And so, the population has not increased by whatever, 6, 7 times in that, not 8 times in that length of time. So certainly, while we were kind of probably a bit undersaturated back in 2007 when I graduated, we're probably a little oversaturated now. So the market is certainly a lot different. But in answer to your question, the reason that I looked at this practice was not because I had any business knowledge, but because it just made sense that there was so much opportunity. The area is growing, as you know, but also, and this 11 years ago, 12 years ago, however long it's been, 2008, the area was growing even more back then. The velocity of growth was quite high. But also, there was fundamental things that I think could have been changed in the practice that would allow further growth. And so I think that was the biggest thing. The fact that I was working in a practice, at the time it was billing about $400,000 a year, and you needed to bill about $500,000 to break even. And so she was making a bit of a loss. And when I looked around, the opportunities were that hardly anyone was open after hours. Our practice was open after hours. Hardly anyone was open Saturdays. Back then, dentists did not work Saturdays. They didn't even work Friday afternoons, knock off at midday, go play golf. So by being open in the evenings and being open Saturdays in a working class area, we already provided a point of difference to patients. No one in the area did wisdom teeth surgery, so that helped a lot. And so we were in a situation where, there's a whole heap of other examples. Back then, dentists were not marketing. A lot of our competitors didn't even have a website, let alone even think about social media or anything like that. So being a young dentist and having a different way of looking at things, I think, really helped. And it took the old guys, a good number of years before they kind of clued onto what we were doing. And by then, we'd already grown to be quite big. And so, I think the market is fundamentally different. Nowadays, you're not going to find many areas other than regional, rural areas where people don't have websites and they're not doing at least a little bit of social media marketing. So it's certainly different in that way. I still think there's opportunities, but you've got to be a lot more, I think, picky about the areas that you choose when you're looking at practice ownership. And while back in 2008, startups were an option, we're getting to the point where I think startups in metro areas are becoming less attractive, and people should be looking at possibly buying into an established practice.
Especially for graduates. So if a student now is thinking, okay, I want to graduate, what should their plan be? Like they want to own a practice one day.
Sure.
What should their short-term goals / long-term goals be to get there and be successful in it?
Yeah, look, that's a really good question. I think first and foremost, they need to get themselves a really good accountant with extensive dental experience. So the accountant needs to have other clients that own dental practices. Now, you'll get all kinds of arguments that say accounting is the same, and you can, as long as the accountant has done some businesses, it doesn't really matter. You might get pressure from your parents to use your uncle who does some accounting that has never had a business or a dental client in his life. and mainly does personal tax returns, that's not the right thing to do. I think you need to find a dental accountant from day one, and make sure you start having these conversations with them around practice ownership, around what the financial metrics of the business look like, all the rest of that. So there's the whole financial education piece, and I think that's important.
Okay.
But clinically, I really think you need to get good at two things. One is extractions. If you can take teeth out painlessly and you can take them out efficiently, patients will be happy with you. In most suburban areas, there is going to be a degree of exodontia. Like, we're going to be extracting teeth, as you know. The second thing is the most profitable part of private practice is fixed pros. So you need to be able to do fixed pros efficiently. You need to be able to be confident in doing the treatment, but you also need to have the communication skills to be able to get patients to convert to that ideal treatment. Because, that one fixed pros case, like, you could do one crown in a day and that might take you 2 hours or however long it takes you. That's $1,600 of billings. To get that from fillings, you're going to be working a lot longer.
Yeah.
So from a profitability perspective, you need to be able to be confident in selling and doing fixed pros. But from a clinical competency perspective, especially if you're going to be out by yourself, you really need to be able to take out teeth proficiently. And I think that's important.
Perfect. So in terms of that, how important is mentorship for a graduate?
Yeah, look, I think moving away from, business ownership, mentorship in itself, I think, is fundamentally important. It will make a difference to the dentist you are after 3 years, after 5 years, the experience you have in your first year. So there's a lot of people that just, take a job out in Woolpool by themselves and it's busy. They see a lot of patients, they get a lot of experience, but they're not really learning. They're not really developing their skills as a dentist. I fundamentally think that a lot of growth happens after dental school. And that's not to take anything away from the teaching at dental schools, it's just that private practice is quite different in a number of areas. And so I think that if you can look at the first 2 or 3 years of post-graduation as an investment into your future clinically, and take a position if you've got some choice, or if you're hunting for a job and you're wanting to know what you should look for. I think having a practice where the principal or the owner is invested in your education and bettering you as a dentist, I think is fundamentally important. Having a boss that allows you to take time off to do CPD, I think, is really important. On top of that, if you can get into a multi-chair practice with a number of different clinicians in a whole lot of areas, I think that's advantageous to working for just a single owner, where you're the second associate. As you know, in our practices, we've got a variety of skills amongst the practitioners, and so being able to tap into the specialized skills of a certain dentist, whether it be in orthodontics or whether it be in surgery or endodontics, whatever it is, it will allow you to grow more. And also, I think when you've got the guidance of a practitioner that's really proficient in some area, like take us and wisdom teeth, for example, they have the confidence to know that even if you attempt a case that might be a little bit too difficult for you, that they'll be able to step in and bail you out. So by working in a practice that has practitioners all at a really high level, you've got an opportunity to really be able to attempt more difficult things yourself, which allows you to sort of grow. Yeah.
With the wisdom teeth, like what you did with me, and I know you've done this with a lot of other clinicians who have shown interest in extractions and wisdom teeth, is that you sort of go through the theory with us again and go through all the plans of like a surgical plan, like how would you approach this, what would you do there, and then we go through like case selection to pick what I can do, and like the levels, and then you'd be there on the day. What makes you so motivated to mentor and be so present in that, given how busy you are with all like the business and every other aspects of your life? What is it that you like about mentoring?
Look, I think fundamentally what I enjoy is having someone who is motivated to learn and then watching them learn. So, obviously yourself as a great example, but before you, Tharini, one of our other dentists, there's quite a few that basically people that express interest in an area that I have some knowledge in. It's actually fun watching their development. Like Tharini, one of our other dentists, for example, has been with us, I think, 6 years now. And when she graduated, she started working for us straight away. And she had a bit of a natural talent, like yourself, with wisdom teeth. But watching her plan, tackle cases, put the time in on her days off to come and watch me do cases, send me OPGs, and watch her develop to the point where now she's one of your mentors, right?
Oh, yeah.
And so I think, watching that development is quite fulfilling, because someone helped me, 10 years ago, I was the graduate and I was the one that was wanting to learn wisdom teeth because that's what I was interested in. And I got provided really good guidance back then. And so I think, in a way, sort of paying it back. But yeah, just I think it's quite interesting to just watch you guys grow, I think, as clinicians. So yeah, that's motivation enough, I think.
Oh, awesome. Going into starting to talk about sort of the business aspect of it, do you ever find it a bit of like a balancing act between business dentistry or an ethical dentistry? Like, I know that you're extremely ethical, but for those out there who are thinking of, it's a business, I need to own this, I need to do that, what advice sort of would you give them to sort of talk to them about the ethics of that?
Yeah, look, that is an interesting question, because I think, as a business owner, I try to think of, what ethical dilemmas are other business owners faced with, right? And one of the most common ones that you're faced with as a business owner is when you've got a clinician who is an exceptional clinician in terms of billings. They're billing $5,000 a day, $6,000 a day, $7,000 a day, or whatever it is. And that's obviously very profitable for you as an owner. But looking at it or deeply into the treatment that they're doing and looking at whether it's of a high standard, and whether it's ethical treatment. So, are they asking patients to remove all amalgams and put crowns on? We had a dentist that was with us for 3 months that she was able to convince patients to get crowns done, which are, as I said, quite profitable. But the crowns were not clinically justified. And so we obviously, as a business that wants to be in business for a long time, that's quite unethical. But I think that was an extreme, right? And that was an easy decision. But I think for a lot of owners, and most owners would not accept that, or hopefully. But I think there's a fine line. That's one example of an ethical dilemma. But I think the guiding principles I've always used are: is it treatment that I'd be happy for my mum to have? Well, if my mum turned up at a dental practice and a dental practice offered her this treatment, and this applies to all our 30 dentists. We look at appointments all the time, and we audit notes and the rest of that, photos, X-rays. And is it treatment that I'd be happy for my mother to have? And if it is, then that's great. And if it's not, even if it is profitable, then you really, my stance on that is that that's not something that we want. Ethics also, I think, plays a role in health insurance and how we deal with health insurance companies. I think that's another big dilemma that dental practice owners are faced with and clinicians are faced with, you guys are faced with. So towards the end of the year, when the patient's benefits are about to expire and you've just done a root canal on a tooth and you've spent a lot of time, finishing this tooth perfectly, and that the temporary filling that you've got at the top of the tooth or whatever you put on there is not the ideal treatment for the tooth, and the patient wants to wait 3 or 4 more months till January comes around and their health fund cover ticks over, and you've got a situation where the wisdom tooth, or not the wisdom tooth, the crown on the the root treated tooth basically could crack because the patient wants to wait for a health fund benefit. That's an area where we as business owners, but also clinicians, are impacted all the time. So I think as long as you have an ethical, I guess, guiding point yourself and you stay true to it through your whole career, I think there's enough in dentistry that we can just stay on the straight and narrow and not have to take the questionable position.
Mm-hmm.
Yeah,
I think that's so much for us as graduates, but also as students, because we don't have any exposure about health funds and about time limits, and we don't know any of that. When we're at dental school, and having those conversations with patients about prices and having those, it's sort of something that I feel like students really would want to invest in by maybe observing in clinics.
Yes.
You know, just seeing a clinic that you like, or your local dentist, or a clinic that you know is successful, and just sort of observing and seeing those communications that you're talking about and those conversations.
Yeah, I think that's a really good point. We obviously offered UQ students to come along and watch us before COVID hit. But I think, reaching out to private practices and going and watching dentists that have a good reputation while you're still a student, I think will go a really long way in ensuring that you get somewhat of a head start into what I guess private practice is like. And yeah, because we're always happy to see students here, and it just makes a difference as well. Because when you do graduate, like I did this before I graduated, but when you do graduate, you have a little bit of a head start. Like you know a little bit more about the conversations, you understand a little bit more about what's happening. It does help. Yeah, definitely.
Do you think, sidestepping from dentistry and business, that your other activities sort of influence you here? And I'm talking about poker because I know everyone's going to ask that.
Yeah. Look, I think poker and business is really... poker's been really helpful to business.
Oh, yeah.
And I've had a little bit of success with poker, and I think some of that success is due to business as well. So I think they're like almost a positive feedback loop.
Yeah.
I think poker teaches you fundamentally about probabilities. It's a game of probabilities. And business is also really a game of probabilities, right? When you're faced with a decision, let's say to buy a new CEREC, like what do they call it? CEREC, like a CAD/CAM system. I don't want to just focus on one system, but let's say to buy a CAD/CAM system, it's let's just say $200,000 investment. When you're going to make that investment, there's a lot of things that you need to consider. And a lot of it is just probabilities. Like, what is the chance that this machine is going to get used as much as it needs to be profitable or to show a positive ROI? And when you break down each of those factors that go into determining that final probability, if you get all of those things right, then the final probability that you arrive at, as long as that has a reasonable high chance of success, I think that that's the way to look at a business decision. The other side of it that I think is really important is to consider what the downside risk is, right? What will happen if this machine doesn't get used and the $200,000 machine just sits there and, you pay the bank $3,000 a month or whatever it is, Can you afford that $3,000 a month if this doesn't turn out the way that you want it to? And I think it's one thing to sort of consider whether you can afford that payment. Most business owners, if $3,000 is going to make or break you, then you probably shouldn't be buying the machine to begin with. But if having that machine there and it not being used and you have to resell it, it's going to be half the price and all the rest of that. So you've got to really come up with probabilities on the input. So, things that you can do to maximize the use, if you're a business owner, for example, is to talk to your associates beforehand, right? And ask their opinion. Are they actually going to use the machine? And then if they show an interest in it, then spend the time and educate them on how to use the machine so that they're not encountering problems that put them off and then they don't use the machine ever again. So, I think if you just break down business, it really is common sense, but a lot of people just don't want to spend the time thinking about the different steps required to execute a plan with a high probability of success. I think the other issue is, and I've been it's been raised with me by a number of people, is that a lot of young dentists these days are impatient, and they compare themselves. I'll get dentists looking at my surgery. It's an 8-chair practice, and we started with a 1-chair practice, and it's been 12 years before we've got it to this size. And it's obviously a facility I'm proud of, our dentists are proud of. But you get a new graduate walking in here 1 or 2 years out, or looking at pictures of this surgery, and that's what they want, right? Like at 1 or 2 years out, and you think they did not see any of the work that went into any of the effort, any of the problems that we encountered, all of that. But there's some rush to achieve that 1 year post-graduation. And I think patience is a big thing. Like, I'm an impatient person by nature, but I think the younger generation of dentists these days are a little bit, they compare themselves, because of social media, Instagram, all of this, to clinicians that have put in the hard yards, but they're only seeing the finished product. And so I think that's something to just be wary of as a young dentist.
Everything's quick, and when you see the cases as well, like on DPR, like when you see cases that are so beautiful, and then you see courses advertised like you can do this on a one-day course, you think, okay, then maybe I should be able to do this. And so no, that makes sense.
Yeah, just keep getting a little more patient.
How important do you think networking is?
Yeah, look, that's a really good one. I think networking is super important in the context of dentistry as a clinical profession, but also dentistry as a business. And I think more so as far as dentistry as a business goes. And when I talk about networking, I really encourage people to network if they want to be a practice owner, or if they are a practice owner, or if they're in the business of dentistry. To network widely, even outside of dentistry. There is so much. Dentistry as a business is a lot easier than a lot of other businesses, traditionally has been a lot easier. And what I mean by that is our profit margins are very high compared to most small businesses. And so because of the fact we're a cottage industry, right? If you want to open a butcher shop, well, it's very easy to become a butcher. It's comparatively easier to become a butcher than it is a dentist. So there's just, we're a cottage industry, but we also enjoy high fees to patients and the rest of that. So the business of dentistry is somewhat easier than other businesses. But when you go and talk to other businesses that have real challenges, that encounter real problems that they have had to solve, because of the nature of the competition in their industry, or because of the fact that their industry perhaps doesn't enjoy the high profitability that we do, by talking to those other business owners, it gives you a ton of insight into, and especially if you have somewhat of a business mind or aptitude, you start to apply all those learnings into the business of dentistry. Because frankly speaking, dentists are not good at business. That's not fundamental to us, right? Whereas we study business, we study a health science. And so when you're looking within dentistry for business advice, I think that can be fraught with danger, because the number of times I speak to practice owners who don't realize they're running a pretty crappy business. They're successful, they're wealthy, but that's mostly because they're good dentists, and most of their earnings are from the clinical work that they do. But when you drill down into their actual business, it's actually quite a poor business. And so getting advice from those people about the business of dentistry is perhaps not the best thing to happen. And this is the trap that I see people fall into all the time. So I think networking is super important, and especially on the business side of it, network widely, network with other business owners in other industries.
And start early as well with networking. I mean, universities are a really good starting point because you get to meet so many people, like even your colleagues, your professors, but also when you do graduate, put yourself out there and meet people. People message you a lot on Facebook, and I know they message Sahil, and it resonates with people when you do sort of reach out. Yeah,
definitely. We've I've helped a lot of people that have just, and I know Sahil especially. I don't think Sahil leaves any of his messages unanswered.
Okay, that sounds good. With the coronavirus, when that sort of hit, what were your immediate thoughts as an owner of how many practices?
Yeah. Look, I think the primary thought for me was around our staff, and what the outcome was going to be to the staff long term. When coronavirus first rolled around and the restrictions started, we went to level 2, level 3. There was a finite number of months that I could have my staff employed at the same sort of pay rate that they were already on, before I needed to cut their hours and cut their take home. And so that was a really big stressor for me. And it was a stressor obviously for a lot of business owners, and the government realised that and responded to that with JobKeeper, and that obviously helped everyone. But I think with coronavirus, it was a really interesting time in that there was so much change in such a short amount of time. And I look back on it now, and at the time I remember being so caught up in the virus and the case numbers and the local community transmission in our areas, giving my dentist advice on what treatments they should or shouldn't be doing, rostering, planning around which dentists are on, what type of marketing we're going to be doing, because that obviously changed drastically. I was so caught up in that I didn't I realised afterwards that I actually enjoyed it a lot, and it's weird to say this, but a lot of my friends actually picked up on it as well. But when everything calmed back down, it got somewhat boring, And as you know, I've obviously come back and started doing clinical dentistry again because I've been quite bored at just sitting at home and not having a lot to do. So we can't travel, we can't do all that stuff. But I think, look, coronavirus fundamentally has changed our industry.
Yeah.
I think people are going to look at things around aerosols, people are going to look at infection control in quite a different way. But on top of that, I think the business of dentistry also is about to get shaken up quite strongly. And we did the associates webinar a little while ago, and we talked about a lot of these things. And we're seeing that initial spike that we spoke about right now. It's obviously very busy at all our practices, in Australia-wide. Dentists are really busy at the moment. But I think when JobKeeper ends and stuff goes back to normal, until the economy recovers, dentistry is not going to be as busy as it is now. And I think we need to learn to cope with that. We need to learn to adapt to that. And I think dentists have to have realistic expectations, right? People are not going to be spending $1,600 on a crown if they don't have a job, and they don't have JobKeeper, and they don't have any prospect of getting a job. They might have been applying all week, and all of a sudden they break a tooth. Well, they're not going to get a crown on that when they're not sure where their next paycheck's coming from. So I think dentists have to be quite cognizant of the fact that we exist in the context of an overall economy, right? You'll get advice from some of your uni professors, you get advice from some of the older guys in dentistry that do not think that dentistry is part of the economy. And what I mean by that is they think, oh, we're a healthcare profession, we'll be immune. But, a lot of what we do is elective. People can always pay $200 and have the tooth removed, right? And more people will choose to do that, and I think that will hurt the industry somewhat for some period of time. And so I think we just need to be clear on that. And unfortunately, this year's graduating class might be in a situation where that crunch happens around the time that they graduate. And my only advice for that is just to be patient. Stick to whatever your goals are, whatever your plans are. Try to meet those goals, but also be a little bit flexible, right? If you've spent 2 or 3 months applying for a job and things are not looking great, and something comes along, well, it might not fit your ideal criteria, but at least you've got a foot in the door, And so I think that's important. Also, moving to rural and regional areas, really consider that strongly. I'm really close friends of mine, Alvin, who's a dentist here now. Alvin and my mate Jono, they graduated and they moved after a year of working up in Brisbane. They moved to regional Australia. They set up 2 or 3 practices. They did really well from those practices. And now that their kids are sort of school age and they want to come back closer to family, they've sold those practices. They've moved back, paid off mortgage, and are able to work 3-4 days a week and kind of enjoy their life. And they're mid-30s or early to mid-30s. So going regional is something that I think people should consider.
Yeah. Going regional, and still sort of applying for jobs that go to the main things that we need to focus on, which is one of them, getting a good mentor.
Yes.
Getting a good a place that will mentor you, you know? I think that's going to be one of the things that it's going to be a lot of jobs out there maybe, or not so many jobs, but so many graduates applying for jobs.
Yes.
And I think it's just still sticking to the job that you find will still guarantee you the goals that you want at the end of it. Yeah.
I think one of the big things about going regional, and to your point, Malak, about the mentoring opportunities, I think when you go regional, you're the principal or the owner of the practice is on average far more invested in mentoring you than a metropolitan owner. And the reason for that is simply that metro owners have a lot of choice of dentists, a lot more choice of dentists than regional owners do. And so regional owners are really invested in providing a high level of education and mentoring so that the dentists stick around. They want to provide them a good experience so that they can retain the dentist, because it's not easy for them to get dentists. So I think that's, it speaks to your point as well.
Yeah. How have you found that your patients, because I know your patients have been loyal through this whole coronavirus, working at Raceview, working at one of your other practices, Ripley, you can see that your following of patients, they've like almost tripled
Yes.
What is it about your practices or the way you run your practices that you think has done that? And how can that sort of translate to like students for them to sort of go into a job with that attitude?
Yeah. Look, I think there's three elements to it. So number one is the staff, right? The auxiliary staff that we have, as you know, are really quite helpful. They're friendly to patients. They look after the patient's best interests, whether it's our reception ladies or whether it's our assistants. They help to provide a great experience for patients. Our dentists, we offer a wide variety of services. We have dentists of different backgrounds, ages, genders, and the rest of that. And I think, some patients will only see a female dentist. Some patients will only want a male dentist, and all the rest of that sort of stuff. So I think providing that variety has certainly helped us in this area. But I think some of the key things that people need to focus on is to understand we've moved away from dentistry just being purely a profession. And what I mean by that is a lot of advice that you guys are going to get from gurus and from people that have succeeded in the past is going to be that as long as you provide great patient care, you're going to have a book full of patients. And that unfortunately is no longer true, right? Because everyone's providing great patient care, right? Everyone, we're learning on social media so much easier than we were in the past. People are doing more complex dentistry. People are going to communication courses. So all of that stuff is now almost a given, right? That's not the benchmark that you should be aiming for. That should just be something that you just do. I think responding to the needs of the economy and the patient is what is important. So what I mean by that is I fundamentally think the reason that we have done so well in these areas is because we understand what the patients want, right? When I'm sitting at home and I'm hungry 10 years ago, I have to get up, get in my car, go and order fish and chips or whatever, it is, Thai, Indian, whatever it is I want to eat, right? Yeah. I can just be sitting at home on my phone, talking to my kids, punch in my order on Uber Eats, and the food gets there. Yeah. Right? And what that's done is created, in an entire population, the need for convenience, right? Convenience kind of is what it's all about for patients, or for people generally. And when you look at convenience in the context of a dental patient, well, you need to be near where they live. So if there's a huge estate that's opening up and the closest dentist is 10 minutes away, well, if you can set up shop in that estate, if there's some commercial property and there's 3,000, 4,000 people in that estate, well, you're immediately going to solve the convenience issue, right? The other thing is this is a working class area. So people often travel to Brisbane, 45 minutes away, Brisbane City to work. And, they get back usually at 5:30 or 6 p.m. And they don't want to take a day off for their dental appointment. That's a day off that's wasted that they could be on holiday. Coming to the dentist, no one likes coming to the dentist. So, being able to offer them that 5:30 or 6 p.m. appointment, being able to offer them a Saturday appointment, all of that I think is important and feeds into the convenience, right? And offering them a product or a service that is consistent. So when they come to Raceview Dental or one of our other practices, they know they're going to get greeted by a friendly receptionist. They're going to have a dentist that's proficient at what they do, is going to communicate well with them, and the rest of that sort of stuff. So I think the overall convenience and experience factor is extremely important, and I think that's overlooked a lot.
Yes.
Because it's hard for a practice of our size to compete with the service levels of an owner across 30 dentists. An owner who's been a dentist for 20 years that owns their own practice and has a staff member that's been there for 20 years with them, right? We are never consistently going to be able to provide across 30 clinicians and 30 staff or whatever, 50 staff, whatever we have, that level of service. But what we do to make up for that is we offer a level of convenience that one-man band cannot do. And so I think you've just got to know your market. You've got to know what the consumer wants, and I think that's really important.
Yeah, know your market and then know your competition as well. Like you said, who's with you and be more convenient for the patient.
Yeah, definitely.
And also, important. What you're talking about with the teamwork, you really include everyone when you're talking about this. You're not just talking about one aspect of it. You've included everyone and you've created this family almost within your practice with that many people. I mean, it's hard to do that when you have 50 plus.
Yeah, look, we've made a lot of mistakes with staffing along the way. Certainly, staffing is not something that comes naturally to me. It's not a science, I guess. Well, it is a science once you know the science of it, but it's not something that is natural to me. So it's taken a while. Hiring the right people has been a big part of it. Getting outside help with HR has been really important to get to where we've come to. And it's always evolving. We're always trying to improve. There's always going to be setbacks. There's all of that. But I think one of the main things is that every single staff member is valued in the context of a single patient. So if you think about, the reviews we get, we try to congratulate all of our team members. It's the friendly receptionist, the dental assistants, as well as the dentist. But on a macro level, as you know, I'm pretty open with the numbers of the practice, right? When we did really well in the months after COVID, or the last month or two, I shared those numbers with the staff and I gave them a pat on the back because of their collective efforts contributed to some of the success that our dentists were able to enjoy in the last month or two. So I think if you want to create a culture that has teamwork and a team, I guess, vision as the overarching goal, then you need to be consistent with that in everything that you do. And I think that's quite important.
Perfect. I think we've learnt a lot about what to look for sort of in a practice, what to look for in terms of our short-term goals, getting an accountant, making sure we've got good mentoring, making sure we're efficient in certain procedures, making sure we've got a vision of what we want and what team we want to build. So
Awesome. Thanks very much.
Anything you want to add?
Look, I think to the graduating class this year, I think you guys, it isn't going to be the best time to graduate. Let's just be completely honest. But and you guys have overcome a lot of challenges during COVID and stopping and starting clinics and the rest of that. But I think the future is bright for dentistry. You're in a profession that you'll hopefully enjoy, and you'll make plenty of lifelong friends and colleagues. But I think don't be too disheartened by things in the first month or two post-graduation. That's my key message. I'm a realist. I'm not going to sit here and say everything's going to be perfect. But in that first month or two, if things are difficult, just stick with it. The profession has had much tougher times than this, right? Back when even 5 years ago, when the overseas pathway was open, graduates were competing with experienced dentists from overseas. There's no international travel anymore, right? Like we're not going to get the influx, and the overseas pathway has closed already anyway. So you're competing with other graduates. You're not having to compete with hundreds or even thousands of overseas dentists that are coming into the country. So I think that's something that's a positive. And so I guess that's my main message. Be realistic, but also remain positive.
Yeah, and you touched on it as well a lot, which is attitude. Like you look at attitude, like as an owner who hires a lot of graduates every year, and you mentor and you have that program in place, you look for attitude really. So even if you haven't had the best clinical exposure in dental school, especially with COVID and just in general, it's not something that employers necessarily focus on, right? Because you learn so much more after dental school anyway, that it's mainly like what your vision is, how you present yourself, within networking with the attitude, like you were saying.
Exactly right. I think that's really important. Most employers these days, dental employers, I run and manage an owners group that has 2,300 practice owners, probably makes up a third of the practices in the whole country. And one of the biggest things in that group is most owners are hiring on attitude, right? So let's say you graduate in December and you don't get a job. January rolls around, right? What's the hurt in hitting up some of your local practices and just asking if you come in and observe, right? Like imagine that happened here. Imagine we got hit up by someone that just graduated and they wanted to come and observe. They interact with our dentist at lunch and they just come and they ask questions, they watch the procedure, and all of that. And all of a sudden one of our dentists, their partner's moving interstate and they're moving with them. Well, who are we going to hire? Are we going to put a job ad out and hire someone external, or are we going to go, look mate, you're up, So I think there's exactly, and I know this is what you were kind of suggesting, I think that's really important, that attitude, that drive, that hunger, I think will show through.
So be persistent, everything will be okay.
Yeah, definitely.
Thank you so much for your time today, Nauv. We've learnt so much.
No, thanks, Nola, for the way that you interview and ask the questions really, I think, gets the best out of me. So it's been good Really appreciated it.
Perfect. Again, thank you, Rachel, and thank you, ADSA team. We hope you enjoyed it. Thank you.